Okay, hi, my name is Donna Grace, and I'm here to show you some skills for Prometrics that you might not be familiar with if you've been here before. So, the first thing I'm going to show you is pericare, and then I'm going to do catheter care. I'm going to show you range of motion. I'm going to show you foot care, and also probably do mouth care, brushing the teeth. That's the only one that you might not be sure of, okay? So we're going to begin. So upon entering the room, we're going to do indirect care skills like we always do. Knock, knock, can I come in? Hi, my name is Donna. I'm going to be a nurse's aide. I'll be right back. I'm going to wash my hands. She will ask you to wash your hands for 20 to 45 seconds, one time. And then after that, you would indicate every time. And then I'm going to identify my patient. Hi, this is Susan. Hi, Susan. I'm going to help give you some care to make you feel more comfortable, okay? So I'm going to pull the curtain. You're going to pull the curtain all the way around. And if they're observing you, you might not be able to do that. I'm going to put down this bar. Make sure I do everything right. All right. When you raise the bed, if they do have a bar, you're going to put that bar down opposite of where you stand. Make sure it's safe. You're going to raise up the bed. And I'm going to leave her flat. Gather my supplies. It should be right here. I'm going to need 2 face cloths and a towel. 2 face cloths and a towel, and chucks, 2 chucks. One for before, one for after. Then I'm going to take out 2 basins. I'm going to put one of the chucks on here as a barrier. You can use a towel if that works. You want a barrier on here. I'm going to have warm water in both of these. One is for soap and the other one's for rinsing. And I'm also going to have some soap. Okay, we have gloves over here. Now I'm going to set up the patient. Okay, Sue, I'm going to just lift this up. The only thing we want to expose is the area that we're working on. And I'm going to have her roll over. And I'm going to put the chucks under her. If there was a chucks, I'd take the chucks out, but there isn't one. Okay. She's helping me, as you can see. I'm going to place this underneath her and roll her back. Like I said, you want to keep her privacy intact as much as you can. And I'm going to put on my gloves, because when you do any type of pericare, because it's body fluids, we wear gloves. You probably know that. Well, you should. Okay. Next, I'm going to take one of these and put it in here and one in here. This is for rinsing, and this is for washing. I'm going to wring this out. I'm going to fold it in 4s. See how I did that? Okay. Then I'm going to put a little bit of soap on the corner of each one of these. 2, 3, 4. All right. So now we're going to start. We'll go from the front, middle to the back. We always go front to back. We're going to do the labia itself, the inside first. Okay. Now I'm going to change and use the next one. I'm going to do both sides. 1, 2. Okay. Then the third one, I'm going to do over here. Okay, now it's all soapy. put that right back in there. Now, I'm going to wring this out, and I'm going to rinse her the same way, only just with water. I'm going to go front to back, and with one, then with the next one, 2, 3, and the next one, 4 and 5. Okay. The only other part that we have to do now is to wash down here a little bit on her thighs, which might be wet. Okay. All right. Now we're going to rinse her. Okay. And dry her with a towel. Dry her. Just pat her dry. Now we've done the front. Now we're going to roll her over. I'll roll her towards me. You can see what I'm doing. Are you okay, Sue? Okay. That's good. You will be doing this probably on a mannequin like Sue here. Just so you know. Okay. Now I'm going to get another face cloth. And this time I'm going to go from dirtiest to cleanest. Or cleanest to dirtiest, I should say. Do the sides here with the soap, okay? Then put a little bit of this here. And you're going to go front to back, okay? Then we're going to rinse both sides, and then this. And then all we have left to do is her legs. Just on the back of her legs, maybe that might have gotten wet, okay? That's the soap. This, you can actually fold this, make it easier for the person, and softer. Okay. All right. Now we're going to dry her on the back side. Just pat her dry. Okay. Now I'm going to change her chucks. We have 3 chucks. Let's put a clean chucks under her. Now that she's clean, we want her to stay clean and feel comfortable. And I'm going to take the old chucks out. Make sure she's on the chucks properly. Cotton pad. Sometimes we use a real pad, sometimes we use chucks. Okay, this I would dispose of in the trash. In the trash. I'm going to cover her up again. Make sure her privacy is intact. Everybody has those rights. Remember, when we're testing, we have to remember patients' rights to privacy and freedom of choice and all that. So let's make sure we remember all that. And safety. Making sure it's safe. Okay, I'm going to lower your head now. Would you like your head up a little bit? No? Okay. That's fine. And this you would use real water, but we're not going to do that today. Come in.
I'm sorry to disturb you, but one of the students had a little bit of a medical issue, and Mom wanted to see